to welcome everyone. It is my pleasure as the local MLA for Halifax Citadel Sable Island to be here to greet everyone today. Although this is an announcement for a hospital that is located in Halifax Citadel Sable Island, the hospitals in this area are Nova Scotia's hospitals, and I think that's very important for all of us to recognize. I would like to bring greetings. I would like to say welcome to our Premier, Stephen McNeil, as well to Ministers Leo Glavine and Jeff McClellan, who have worked very hard on this file. At this point, I would like to welcome Janet Knox to come up forward. I'd like to also welcome our viewers online who are watching today's proceedings. And Janet, I'd also like to, on behalf of our government, thank you for all of your hard work and leadership as the President and CEO. Thank you.
Thank you, Minister Casales. Oh, it's taller than I am. And thank you all for joining us here today. I woke up this morning and thought, this is a really important day. Something great is happening. And it's an important day for all of us who share in a vision of healthier people in Nova Scotia. Healthy people, healthy communities for generations. I especially like to welcome Premier McNeil, Minister Glavine and Minister McClellan, our Deputy Minister of Health, Dr. Vaughan, members of our Board of Directors from Nova Scotia Health Authority, members of our foundations and auxiliaries, members of Nova Scotia Health Authority, my colleagues that I work with every day, and you, our guests. This event is being broadcast live online, and we're so pleased to be able to share this event with the people across our province. Today, this news is about us, and it's for all of us. Today, we're at the Halifax Infirmary of the QEII Health Sciences Centre. The QEII includes two sites, this site and the Victoria General Hospital site, and it has 10 separate buildings. The QEII is truly a resource for all Nova Scotians, a place where care providers see a million patients a year. And about 40% of those patients come from outside of Halifax Regional Municipality, and many of them come from Atlantic Canada. It's a place where thousands of our learners from all health professions prepare for taking on health careers. And our researchers contribute to the knowledge needed to provide the best, the most innovative health services. Today, some of the most complicated, sophisticated services are delivered in our aging Centennial and Victoria buildings. Services will be moved out of these buildings. In planning for the move of these services, we also have the opportunity to design safe, quality environments for our patients, their families, for our physicians and employees, and our volunteers for generations, not just for today, for Nova Scotians well into the future. We also have the opportunity to establish services and supports from the most basic care to the most specialized that are based on the needs of Nova Scotians and are grounded in evidence and best practice. And we will ensure that we deliver the appropriate care at the appropriate time by the appropriate provider. The changes and enhancement that we will describe to you today, work that's already well in progress, involve not only the buildings that comprise the QEII Health Sciences Centre, but other facilities and resources throughout the health system. This reflects our provincial perspective that the Nova Scotia Health Authority brings to this effort. So what kind of changes are we talking about? We'd like to show you. So we have a video.
Nova Scotians are proud of their healthcare system, and for good reason. The QEII Health Sciences Centre is a leading research and teaching centre, delivering highly specialized services for all Atlantic Canadians. But healthcare needs are evolving, and it's time to change the way we deliver healthcare. The Centennial and Victoria buildings are aging. Over time, services will be moved elsewhere as we construct a healthcare system that meets the needs of Nova Scotians for the next 50 years, not the last 50. And the work has already begun. Designs are underway to add and reconfigure inpatient beds, operating rooms, ICUs, and support services at the Halifax Infirmary. These state-of-the-art facilities, the heart of the new system, will be equipped to handle some of the most complex care in our region. Renovations and expansions at Dartmouth General will mean 48 additional beds and 4 new ORs. Work will soon begin to reopen a second OR at Hants Community Hospital, and capacity at Scotia Surgery may be increased in the coming months with no construction required. These changes will mean better access to the healthcare Nova Scotians need. The Nova Scotia Cancer Centre at the QEII will be enhanced, leading the way for innovative and research-driven cancer treatment. A new residential hospice will allow patients to spend their final days in a more home-like environment. And we will develop 2 new community outpatient centres, bringing services closer to communities. This is connected care. Thoughtful, innovative, and stronger to ensure the needs of Nova Scotians remain at the heart of everything we do.
It's my pleasure to invite Dr. David Kirkpatrick. Dr. Kirkpatrick is our Chief of Surgery in the Central Zone of Nova Scotia Health Authority. He's also the head of the Department of Surgery for Dalhousie University. Dr. Kirkpatrick has had his career here, and he's going to tell you about the QEII Health Sciences Centre.
Good morning. Thank you. It's a welcome day to be here and speak to you about the future of some of our hospital-based services and how they might better serve the health of Nova Scotians. At this very moment, a few floors above us, people from across Nova Scotia and indeed the Maritimes are undergoing life-changing surgery. Whether it's microsurgery, neurosurgery, heart surgery, or joint replacement surgery, those patients are receiving top-quality care from teams of doctors, nurses, and other healthcare professionals. Those healthcare teams are not only informed by the latest research, but they are conducting it. Most of these patients have passed through other parts of the healthcare system. Perhaps they've been referred by their family doctors, had MRI scans, CT scans, had their blood analyzed in our laboratories. Maybe after their surgery, they'll spend time in an intensive care unit. Later, they'll come back and they'll pass through our ambulatory care centers for a follow-up visit. They may receive the care of a physiotherapist, an occupational therapist, or perhaps support from a social worker. We know the poor physical state of the Centennial and Victoria buildings at the VG site has rendered them unreliable, and this is reason enough to move patients and services to different locations. Additionally, healthcare delivery has changed dramatically in the decades since those buildings were conceived and constructed, rendering them obsolete in design. We have the opportunity today to organize our services and facilities in a way that better suits the evolving nature of healthcare delivery and the future needs of Nova Scotians. This task isn't about replacing out-of-date buildings. It's about improving how we care for our population. Some of the care I referred to earlier needs to happen in a place like this. By this, I mean the Halifax Infirmary, where highly specialized procedures are performed by experienced teams whose skills have been honed by the volume of work they do at an academic center like this one. Organ transplant are an example. Today, those surgeries take place at the VG. In the future, that will happen in this building. Bringing more of that work to the Halifax Infirmary will ultimately require moving several operating rooms from the Victoria General Hospital, along with all of the necessary inpatient beds, ICU beds, diagnostic imaging, sterile reprocessing, etc. However, this site is already full. So accommodating these services will be very complex and very challenging. The move will occur either as a phased approach or all at once, depending on the best information available. The move will include a combination of relocating services out of the HI to a more appropriate setting, repurposing of underutilized nearby space, and new construction. There are things we do today at the Halifax Infirmary that could be done just as well outside these walls. Some of these are either outpatient visits to a specialist or day procedures. Some may occur in a space that we could build or develop nearby, while others could occur farther afield, outside the downtown core of Halifax, providing greater accessibility to people coming into the city for appointments. Similarly, we can begin to make use of existing facilities such as Hants Community Hospital and Scotia Surgery, where many patients have had great experiences and excellent care. In partnership with Hospice Society, we will also help develop a much-needed residence for palliative care patients so that people will have the option of spending their last days at in a home-like setting. The orthopedic surgeons of Nova Scotia have recommended that the orthopedic surgery services expand at the Dartmouth General Hospital site. To that end, 2 orthopedic surgery positions at the Halifax Infirmary site and associated resources could be transferred to the Dartmouth General Hospital at some point after the new ORs being developed there are complete. This vision includes a modern, efficient joint replacement program that would help deal with the long wait lists for these procedures. Very few of us will be fortunate enough to live out long, full lives and not have to access healthcare services. All of us then will benefit from a thoughtful approach driven by evidence and the needs of Nova Scotians. We are already several steps down that path and look forward to the future. Thank you.
Thank you, Dr. Kirkpatrick. I'd like to take a moment to talk about how we will get from here to there. We have a task ahead of us together that I believe is unprecedented in Nova Scotia, both in terms of its scope and in the impact that we can have on the health of Nova Scotians and the quality of care they receive. There are a couple of factors influencing the way we are approaching this work. We do not want, nor would it serve anyone well, to simply build a structure to replicate the current Centennial and Victoria buildings, and then move all the patients, staff, physicians, volunteers, and equipment once it's done. And we must continue to provide a full range of services, high-quality, safe services, with minimal disruption throughout the time it takes to develop the modern and appropriate spaces in existing and new facilities that you've just heard Dr. Kirkpatrick talk about. So the work that we're in the midst of involves a number of different locations, some small changes, some major renovations, some new construction. But what we are absolutely thrilled to hear from our government is the direction not to wait on one piece of this project to complete before we start the other one. As we move from detailed design to construction of the inpatient and operating expansion at Dartmouth General Hospital, we will also be working to reopen the second operating room at Hants Community Hospital. And we will configure the 5th floor operating rooms and intensive care unit in the Halifax Infirmary site, and carefully plan the initial transfer of services from the VG site, and design the outpatient centers where some services would relocate to make way for others inside the Halifax Infirmary. Certainly, some aspects of this project are contingent on others, and it will take 5 or more years before all patients and services have been relocated from the Centennial and Victoria buildings. But Nova Scotians do not have to wait that long to see improvements across the system. We are committed to that. As we look to the future, I want to thank our employees and physicians, volunteers, and learners for the exceptional work they do today and every day, and have done all along despite the challenges of our current infrastructure. We hear over and over from families, from patients, that the quality of care is impressive. I always love getting those letters and those phone calls. And we know that the staff supporting that care, our housekeeping, porters, food and nutrition workers, our maintenance, put great efforts into ensuring that the people who use our facilities have a good experience. I also want to acknowledge the generous support of our foundations and auxiliaries, and in particular, I want to note the QEII Health Sciences Foundation, the Dartmouth General Hospital Foundation, and the Hants Community Hospital Foundation, who help us provide that quality care every day. The work we have outlined today will be a legacy for the province and the Atlantic region. This redevelopment of the QEII Health Sciences Centre will support the improved health of our people in a way previous efforts could not have. Thanks to the provincial perspective we're able to create and take here with the Nova Scotia Health Authority. It is my pleasure now to invite the Honourable Stephen McNeil, Premier of Nova Scotia, to speak.
Thank you very much, Janet. Thank you for your leadership, not only on this project, but delivering health services across our province. Dr. Kirkpatrick, it's always great. I hear I missed an impressive moment early on when you were asked a question and your answer was no. I wish my colleagues had been here because they think I'm the only person that says no. So thank you. And I want to, first of all, begin by saying thank you to the healthcare providers who are here, those who may be listening across the province. I want to say thank you for the service that you deliver to Nova Scotia families from one end of this province to the other. We are talking about physical infrastructure, but I can tell you Nova Scotians, person after person, when they talk about our healthcare system, they talk about you, the individual service provider who's delivering that care to them, and they talk to you in one glowing fashion. So I want to say on behalf of all Nova Scotians, thank you for the work that you have been doing. Thank you for the work that I know you will continue to do in the top quality that you have been doing. It was very long before, right after becoming Premier, when the file of the VG became on my desk. And while many see that as a problem, I see that as a real opportunity for our province. And what you're seeing here today is the building on that opportunity. We could do, as Janet alluded to, build the same facility, and if we did that, it'd be shame on us. This is not about the last 50 years, it's about the next 50 and beyond. This is a real opportunity for us as a province to shape the healthcare delivery model in our province. One of the very first decisions we made as a government was to invest in the Dartmouth General. Very pleased to see that progress going on the third and fourth floor. Looking forward to the OR suites that will be completed there, bringing it to 8, and as well as the renovations that take place on the 5th floor. That's an exciting opportunity. When I sat down with the health authority and the healthcare providers, one of the things I asked them was, what are the services that we're providing downtown that have to be there, and what are the ones that don't have to be downtown, and how can we deliver them in the capacity of our other healthcare services? Or quite frankly, as we look at building new infrastructure, maybe we need to look at where people are living and the migration patterns of our citizens. I think Dr. Kirkpatrick would have told you 40% of the people who use the services downtown live outside, coming down into the center, often creating issues for them, whether it's parking or finding their way downtown. This gives us an opportunity to change the footprint of our healthcare delivery model. As has been said before, there are things that have to happen downtown. There are things that have to happen on this site, and we're so excited about the work that is now taking place on the 5th floor that we'll see some ORs being moved over. It's really hard to believe, quite frankly, that double organ transplants are happening in another facility and moving back and forth. It's time to unify all of the support staff around that in this one facility, and I'm looking forward to the day that that happens. The fact that they brought to us that there's an opportunity in West Hants to use already current infrastructure with some improvements. 800 surgeries can take place in our Windsor Hospital in the 2nd OR. That makes good sense and good value for the people of the province of Nova Scotia. And on top of that, when we talk about an outpatients clinic, we need one here. Of course we do, one that deals with specialty services. But a community outpatient clinic outside of the downtown makes sense when you look at the migration patterns of the citizens that will be using these facilities. And I look forward to that clinic evolving over a period of time and us getting an opportunity to go out and talk to community, talk to healthcare providers to make sure that that facility responds to the needs of our citizens today and tomorrow and for the decades to come. And I can't tell you how pleased I am to be working with the hospice community. All of us have experienced in our own personal lives a loved one at the end of life. This is a model, in my view, it's time to happen here in Nova Scotia. Of course, we'll always have to have palliative care in our healthcare facilities. Some of our loved ones will require that really specialized pain, medication, and services. But the hospice environment is a wonderful opportunity for communities to be able to work with their government to provide the end-of-life care that I believe many, many Nova Scotians want and deserve. This is our chance as citizens. We're often talked about that our own health care, our individual personal health, is in our own hands, and it is. But this is our opportunity, really a generation. We're a generation that has an opportunity to shape the healthcare delivery model for the next 50 years. This is a real honor and a privilege for us. I make a commitment to you as healthcare providers and citizens across this province. At every step we go, you will be involved in the delivery, in the building, in the planning of ensuring that when we're finished, this facility is exactly the kind of facility you believed it would be, and it's the kind of facility that you require to deliver the top quality care to our citizens, and that it is delivered and spaced across this region so that it is patient-focused and accessible by all Nova Scotians. This is Nova Scotia's healthcare facility. All Nova Scotians, regardless of where I am, talk to me about this hospital. And it is a commitment from the day I became Premier. Our budget recently made it a commitment, and we're going to continue to make this a commitment so that at the end of the day, Nova Scotians will look at their hospital with pride and recognize that they had an opportunity, along with all of you, to build and to shape the healthcare delivery model into the future. Thank you so much for being with us today.
Thank you very much, Premier McNeil, and thank you so much for your support of the health of Nova Scotians. More people than I can name here today from our departments of health and wellness, transportation and infrastructure renewal, finance, many other partners, and my colleagues here at the Nova Scotia Health Authority. We have been working really hard as a team to focus on this very important resource for Nova Scotians and indeed Atlantic Canadians. I thank everyone for their efforts, and we make a commitment together to continue this work on behalf of Nova Scotians. And as Premier McNeil has said, Nova Scotians want to know and want to be part of our planning. And we know that people will have questions about this project as we advance and will be interested in updates as all of the pieces unfold. And so today we have launched together a website that's called the QE2 Redevelopment.ca. It's QE2 Redevelopment.ca. And the information will be uploaded from today, and that will be a place where people will be able to go and get further information in the weeks and months and years ahead. So thank you all for being here today. It's been a real pleasure. This is a great day for all of us, a great day for Nova Scotians. Thank you very much. We'll now have an opportunity. I'll turn it over for questions.
We'll do 10 minutes here with questions, and we'll set up the scrums like that. Who did you want at the podium? Yes, please. It's just that we're already. Who did you want at the podium? Premier, please. Sure.
It's the first time I've ever had that.
What is your commitment in terms of funding this project?
We've made a commitment that, as you know, the renovations required at the Hants Hospital has been committed to in our unallocated TCA now, so we'll be able to move that project once we get finalized to what those numbers look like. We've already budgeted for the design and work that's taking place on the 5th floor here at this hospital. We've already committed to ensuring that we've prepared to when we put an RFP for design of the remaining projects, all of that has been funded. As you know, the Dartmouth one has been announced, that commitment has already been made and budgeted for. And then when we get a final costing of the design work that goes out, and then we will go out to Nova Scotians, tell them the true cost of what those new builds will look like and the renovations. And at that time, we will make a commitment on how we fund it.
But are you committing to the timeline that they put forward and making sure that it stays on that?
That's exactly where we're headed. We're going to be on time and on budget. We'll know that once we get an opportunity. As I said, it would be inappropriate for me to tell you that now. When we put the design work out, we'll make sure that that'll be all part of that, and then we look at the financing models and how we ensure that this facility is paid for and in place. But I can tell you, I've heard from Nova Scotians across the province. They want their healthcare facility now.
Premier, where do you see P3s fitting in? Obviously, the outpatient clinic that you're talking about seems a candidate. Can you talk about where you see P3 working here?
They could be in any part along this project, but we've not made a commitment to that, but it will certainly be part of how we look at it. It's a potential finance possibility.
Premier, looking at the Dixon building, that is still going to be operating. More cancer care work will happen there.
Yep.
How do you explain to patients who will have to go there and still be in a building where they can't drink the drinking water?
No, as part of that, the Dixon, you might be better to answer that question, but we will be making renovations also to the Dixon Centre, continuing to build on the great asset that is there for Nova Scotia today. There will be an expansion as part of that. I'm looking forward to this is an opportunity to do more research, an opportunity to look at innovation. It's a role that I believe the national government can help us play when it comes to ensuring that we continue to build on the world-class cancer facility that we have and continue to make it a shining example, not only in Eastern or Atlantic Canada, but quite frankly in Canada.
Premier, are any of these changes, any of these parts of these plans contingent on federal funding, or if they don't
No.
jump in, it's up to you?
Listen, I made it clear, I've said to you before, I see this as an opportunity. It's a problem. I don't run from them. We have to deal with it. I've asked to be the privilege to be the Premier of this province, and I intend to tackle this issue as a government. We're committed to it. If there are roles that the national government can play, if we can see an opportunity for them, that's great. If not, we're going to continue to work with our partners across this community. We have world-class healthcare providers in this community. They're providing wonderful services, and we're going to make sure that the assets that they're working in reflect the great service that they're already receiving in Nova Scotia. Sarah, did you?
Sarah, go ahead.
You know what? When we get to a point where, particularly on this site, where we may be receiving other Atlantic Canadians, that's a conversation I'll have but it's not contingent on them. Obviously, the work that's happening outside will be used by Nova Scotians. The stuff that's happening in Windsor, we see the community outpatients one, but we'll have a conversation, but it's not contingent on that, quite frankly. We have arrangements with our sister provinces already on other delivery models, whether it's the veterinary college that we commit to a certain level of funding, they do the operating. So you can be certain I'll make the ask, but we're moving forward. Sarah. The foundations are critical to all of the work that we do as a government and in delivering health care to our citizens. I can't thank them enough. But I think this is unique. Often there's a funding model. I don't want to speak out of turn, but I don't think we're going to ask the QE2 Foundation to pick up the entire 25% cost that would sometimes be associated with that. This is the Nova Scotia facility. Will require all Nova Scotians to help us in that journey, but we're going to continue to move forward as a government. This is somewhat unique. It's not like when we're doing an addition to the Annapolis Community Health Centre or buying a piece of equipment for the Annapolis Community Health Centre. This is something that will be used by all Nova Scotians, but we'll certainly be relying on our foundations to help us as we go forward.
I understand that you don't have the design work, so you can't really say, but surely you can share with Nova Scotians what kind of dollars are involved. I'm not looking for the cent, but it seems to be fair to ask you, what kind of dollars are we talking about in the 5-year development of your center?
Well, it would be irresponsible for me, Paul, to throw a number out without having gone out and done, having the design work done, having the expertise that is required to come in to ensure that these facilities are you know, that the infrastructure inside of the facilities are exactly what we want, and then we'll go and get a true cost of what that looks like, and we'll communicate it to Nova Scotians. Janet has said there's a website up. We're going to continue to go through this process. I've made a commitment to Dr. Kirkpatrick that and his healthcare teams across this province that they will be part of this journey. The last thing I think any Nova Scotian would want us to do is build a facility that wasn't what our physicians, our nurses, our technicians were looking for in an environment that they want to work in. So we're going to work with them, and when we get the final design, we'll put it out, and when that number comes, and we'll communicate it to Nova Scotians.
When are you expecting to get that number?
There's various stages along the way. As I said, right now there's an RFP out for some work taking place on the 5th floor here. There are other stages along the way in the design. I can give you all the dates on when we expect those to be out.
Premier, some people would look at the consideration of expanding the use of Scotia surgery in a critical way, in a negative way. Can you talk to what role you see them playing and why you think that is an avenue worth pursuing?
Well, I think, the good news is success. All political parties in Nova Scotia have endorsed Scotia surgery. The Conservative Party introduced it, and the Democratic Party continued to arrange it with them. We believe it's a facility that can be part of the solution. That will depend on whether or not we can negotiate an agreement for the final 2 days. There's currently 3 days of operations that take place there now. But we see them as part of the solution, and Nova Scotians who are relying on that facility for services today have had positive experiences. So it would only make sense for us to look at the remaining 2 days.
Premier, how will it work with funding or contributing to the operating costs of Hospice Nova Scotia? How will that private-public thing work?
Well, the hospice is being built by the Hospice Society, 100% construction, and we're in the final stages of working with them to find an operational agreement where it will be a blend of the hospice community and the province. We will be moving 5 of our palliative care beds that we are currently funding in the hospital into the hospice environment. There will be additional 5 that will be there that the community support. This is a great partnership. Not only is it, in my view, an appropriate service to offer Nova Scotia families at end-of-life care, but it really shows what can happen when government and community work together to find a model that allows us to really care for our families and citizens across the province.
After demolition, is there an idea of what would go in the existing VG site?
No, I haven't got that far. I'm going to ask Nova Scotians to keep me around long enough, though, so I can be part of that discussion.
Are you considering selling that site?
Listen, our focus has really been on ensuring that we deal with delivering and changing the delivery model here in the province. But I do want to say about those sites, while there has been lots of news about them and negative news about them, Nova Scotians should rest assured they can continue to receive the services they've come to expect from the top quality healthcare providers in those facilities until we build and replace those units. So we'll decide at the end of the day what happens on that site, but we're preoccupied right now.
Was there anybody else that you needed up at the podium for questions before I move?
Thank you so much.